Tsung-Mei Cheng is a health policy research analyst at Princeton University, and I asked her about the challenges of containing coronavirus across Europe.
Well, the WHO people also made the point of saying that these individual country outbreaks does not necessarily suggest the emergence of a pandemic or a pandemic in the making. Because in each case, in South Korea, in Iran, and in Italy, the outbreak was associated with particular situations, such as church gathering. And if you look at the Chinese cases, usually they tend to cluster around families. So WHO tells us that we should be sort of think of country outbreaks as individual country examples and not panic. We should put top priority on protecting the country's healthcare workers, the doctors, the nurses, and all the other healthcare workforce, because we need them to take care of the ones that's stricken with the virus. And the second priority is that we should, within each country, take care of our vulnerable populations. And by that I mean the elderly and people who may be already sick or are immunocompromised or with certain pre-existing conditions. And third priority is that we as a global community should help those countries who may not yet be prepared to meet such an outbreak, to get ready to be prepared in case of an outbreak, and also to help them to be able to be in a position to contain the outbreak. The WHO, I just read that, is training something like 11,000 workers, healthcare workers in Africa to help them get prepared. Now, this is not to say that Africa in particular as a continent needs help, because Africa in fact has very good experience in dealing with outbreaks of other types of infectious diseases such as Ebola, polio, but with this particular virus, the continent is not quite as prepared as they ought to be.
Well, that being said, are you concerned about the differences and the levels of various health systems from country to country, where one country, a larger country, may be better equipped or may have the people that can, focus and deal with a coronavirus versus other parts of the world where they may not have the same situation?
Exactly, yes. I think in general, it's true that the richer countries are in a position to marshal more resources to deal with the outbreak. You take Europe, for example. Right now, the European healthcare systems, they are very efficient health systems. The WHO experts pointed out that, but they are so efficient that their beds are more or less at 100% occupancy, with the exception of Germany. Germany has excess hospital beds. But in other health systems, they don't have excess beds or enough of them to accommodate a sudden outbreak. But these countries have the resources to make the provisions that they need. Whereas in a resource-poor country, where the healthcare system is underfunded, under capacity, then the challenge would be much greater.